When Kevin Rutkowski got tested for COVID-19 in early August and asked about his results, he received 3 different answers from 3 different government employees. A contact tracer told Rutkowski's wife, Lora Nigro, over the phone that Rutkowski had tested positive. But days later, someone at the Wisconsin Department of Health Services told Rutkowski his test was actually negative. When a different health department representative called Rutkowski later that day, the employee told him his test results had been lost altogether and that the data appeared to be missing, Rutkowski told Insider in an interview. In total, it took 2 tests and roughly 2 weeks for Rutkowski to confirm that he was, indeed, negative for the coronavirus, and could safely return to his job at a local technical college. Rutkowski was initially tested on August 6, the same day as Nigro, who received her positive test results by August 8. Though Nigro developed a fever and some mild respiratory distress, Rutkowski said he never had any symptoms, so when he initially heard his test result was positive, he assumed he no longer had to distance himself from his contagious wife. But the saga to obtain his accurate results so that he could return to work was nothing short of a show, he told Insider. My frustrating part was just that I would have liked to know the results of the way I tested a little earlier. I probably would not have let my guard down around my wife, after a week or so, not knowing if I was still negative, not knowing if I'm going to get it later and test positive, he said. It just keeps you in this kind of quiet anxiety. I don't know how else to explain it. A healthcare worker assists a motorist with a nasal swab test at a drive-in coronavirus COVID-19 testing center at MTO Shahmaghsoudi School of Islamic Sufism on August 11, 2020 in Los Angeles, California. Getty Images. TemaThe. The Wisconsin Department of Health Services did not immediately respond to Insider's request for comment. Rutkowski's scramble to learn what happened with his COVID-19 test is not unique. Even as coronavirus testing across the country has markedly improved from the early days of the pandemic, data and interviews with patients show that many are still unable to access timely results, and those delays are affecting Americans' ability to work, attend school, and spend time with their families and friends. More than 6 months after the coronavirus pandemic began sweeping across the U.S., speedy and accurate testing remains out of reach for many, even as businesses and schools reopen and Americans return to their day-to-day lives. A recent nationwide survey of 19,000 U.S. residents conducted by researchers from Harvard University, Rutgers University, Northeastern University, and Northwestern University found that the average wait time to receive COVID-19 test results was roughly 4 days.